Kenya's Ministry of Health recently warned that the fourth peak of the COVID-19 pandemic will be in the offing in July. Acting Director of Health, Dr. Patrick Amoth, said the pandemic has established a pattern where a peak is witnessed after every 3 months. So this means that counties have to be in the forefront of ensuring that they play their part in fighting the virus. Now, Daniel Kariuki is speaking to the Nyeri Governor, Mutahi Kahiga, on the measures that counties are putting in place. Daniel Kariuki, good morning. Over to you.
Right, you've said it right that the Ministry of Health has, of course, warned of the fourth wave of the COVID-19, even as the government moves to try and ensure that there are vaccinations across the country as they continue to push for the importation of different types of vaccinations or other vaccines. Now, we want to discuss about COVID-19 and counties' preparedness in terms of the fourth wave and how the counties are prepared. Of course, when you talk about matters health, the Nyeri County comes into the fore, and we want to speak to the governor of Nyeri County to just have a sneak preview, or rather have an idea of how the county government is prepared in case we have the fourth wave that the Ministry of Health has warned that it might be happening maybe in July. And so we want to speak to the governor just to give us an insight. Now, thank you very much for giving us this opportunity. Of course, thank you. Of course, some few weeks ago, you addressed the media concerning the COVID-19 and put some protocols and restrictions to try and ensure that the surge in numbers is actually dealt with. Maybe you can just bring us to speed with this. Have you maybe lifted some of the restrictions, and what's the latest? And if the county government is prepared for the fourth wave in case it happens.
Thank you very much. Yes, indeed, we have seen results from the protocols that we put in place a few weeks ago. I'm almost close to a month. Remember, we did close our offices and decided that everyone, majority of our employees would work from home. Remember, too, that we were left only with essential services progressing on and available. And looking at the statistics, we have held a meeting, an intergovernmental COVID response meeting, which I and the county commissioner share once every week, every Thursday. And from the result, from what we can see, there is progress. And we think we may be overcoming the third wave. But we are shocked to hear that, yes, the fourth wave is on its way, maybe around July, and this is the Indian variety. And we will say it's really a shocker. We will just put in place further measures. We haven't actually even lifted these measures. We are still asking our people to continue working from home, those that are above 58, and those that are not offering very, very essential services to continue working from home. But as a county, yes, we are prepared. Remember, July we will have rolled over into the new year, and in the new budget I have put in 3 billion Kenya shillings that will go towards health. As you are speaking, we are in the process. Right now, the County Public Service Board is seated in Nanyuki. They are sorting out issues of the 75 nurses we are hiring, critical care nurses and all kind of nurses, 70 of them that we are really hiring as part of preparation for an eventuality. And really, Mount Kenya is already running. We have done the oxygen plant and we have fixed about 47 beds. We also have Karatina, level 4 hospital, where we have about 130 beds already fitted with oxygen. The oxygen plant, we fitted it, it's working. And so we can say we are prepared. We have, remember Odaya, we had also Odaya level 4, we had set aside and moved all the patients in preparation for any surge. Really, so I can say that as a county government, I want to tell the people of Nyeri, we are prepared and we will continue putting in place any other measures that we deem necessary towards the checking of this spread of the COVID-19. But beyond everything else, we must remind our people that the battle against COVID-19 must be personalized. It is an individual battle. We must ask our people to take first, before anything else, personal responsibility. Let us wear the masks. Let us sanitize and clean our hands and wash our hands, avoid crowded places. And also a message to the politicians. We know you have already started these campaigns. Kindly, please, for the sake of our people, stop these meetings. Let us follow the protocols as given by the GOK and MOH. Let's have a minimum of about 15 people per meeting, funerals about 50, and let us leave it to the family.
Right, and of course, counties received vaccines, actually all the counties across the country, and Nyeri County received approximately almost 800,000
No, vaccines. We received 33,000.
33,000.
Yes.
So, as we speak, have all the vaccines been administered? We had the Ministry of Health saying they are going to recall some of the vaccines in counties that are not administering, or there is low administering of the vaccine. Maybe from the Nyeri County, have you vaccinated all the health workers, maybe teachers, and maybe the COVID numbers? How do they look?
I'll give you the numbers. We are at 35,000, almost going to 36,000, despite us having only received 33,000. But because of the care and the training of the nurses we have in Nyeri, when you receive one vaccine, there are 2 extra that are always set aside because of waste. We've been so careful. Instead of getting 33, we now have 35,000, and we have done it across across board. Teachers, doctors, nurses. Remember, we were not forcing anybody, and people had to volunteer. And so the nurses who came forward received their doses, the first dose. The doctors too, the teachers, the askaris. We have done all we can, and we are waiting for the second dose we are promised to come around June. But we have done the very best, and I really want to appreciate the nurses. Remember, we opened up the space, the vaccination space, by creating 17 different vaccination centers. And that is how we have been able to reach out. And so Nyeri does not have any vaccines remaining. We are awaiting any vaccines. If there are counties that are not ready to uptake, why don't we get them and we can give the second dose? Right. We are ready to do that.
Right. Thank you. Thank you very much, Governor, for giving us the insight and bringing us to speed with the latest in terms of COVID-19 and the preparedness of the county government to ensure that there are no surge in numbers. Now, that's the situation, and of course it's a topic that we'll keep following up and we'll keep the viewer updated. But for now, I hand it back to studio.
All right, thank you so much, Daniel Karaoke. Definitely everyone has a role to play when it comes to fighting COVID-19 here in the country. Time for a short commercial break. I'll be right back with more news making the headlines, so definitely do keep it KTN News.